Okay, guys, my presentation is on hepatitis C. Hepatitis C is a single-stranded RNA virus that affects the hepatocytes in the liver. It is the hepacovirus genus of the Flaviviridae family. It's made up of lipid membrane envelope with glycoproteins E1 and E2 embedded in the envelope. You see there's E1, E2. It's the E2 protein that interacts with a high-density lipoprotein, scavenger, tetraspanin, claudin, and occludin receptors on hepatocytes. When E2 binds to the tetraspanin and scavenger proteins, claudin-1 is signals which triggers the entry of the virus into the hepatocyte. The hepatocyte engulfs the virus through endocytosis, and the hepatitis C virus releases the RNA and replicates in the cytoplasm. The new hepatitis C microorganisms then bud into the secretory pathways and are released from the surface of the hepatocyte, so they're free to infect other cells. The types of hepatitis are A, B, and C. Hepatitis A is spread through the fecal-oral route from food or water contaminated with the virus. Hepatitis B is spread through blood, semen, and vaginal secretions. And hepatitis C is spread through blood and body fluids. There's also hepatitis D that can develop from hepatitis B. There's no current vaccine for hepatitis C like there are the others. In recent years, hepatitis C has been rising in people younger than 30 because of the increased use of heroin and other opioids that are injected. The most common way it's spread is among IV drug users. It can also be spread through blood transfusions, tattoos, and sex, and incubation can be anywhere from 2 to 26 weeks, but it averages about 7 weeks. Symptoms can include right upper quadrant pain, jaundice, fatigue, itching, nausea, and impaired mental function. Jaundice, you can see here the yellow in his eyes. It's caused by a breakdown of red blood cells. When they break down, bilirubin is released and builds up, causing the eyes or skin to become yellow. Since the liver metabolizes many substances, when it's not working properly, the substances can build up and cause cognitive problems and other symptoms like jaundice. People with hepatitis C virus can be asymptomatic though. They could easily spread the virus without knowing, and their liver could become damaged if they don't get treatment soon enough. Hepatitis C is a leading cause of liver cancer and cirrhosis, but it can be cured with medications in 8 to 12 weeks. People should avoid activities that exacerbate the viral effects, such as alcohol abuse. Hepatitis C is diagnosed with a blood test and usually treated with a combination of antiviral drugs and interferon. There also may be follow-up tests to assess liver damage, like an MRI or a liver biopsy. Blood donor screening and use of sterile needle supplies is the best way to prevent infection. People with acute hepatitis C are more likely to experience symptoms. In chronic hepatitis C, fatigue may be the only symptom, which can lead to delayed diagnosis. It usually takes many years of chronic hepatitis C to lead to liver cirrhosis or necrosis, so getting diagnosed is key to avoiding cirrhosis and liver necrosis. And there's that last slide there. I kind of passed it fast. All right, thank you guys.